Hello everyone. We have with us today Manisha Patil, who is a CSR lead for Amazon Community Engagement. Hello Manisha, welcome to DC Conversations.
Thank you.
So tell us first thing, how does supporting sanitary napkin manufacturing facility align with your community goals as an organization?
Our organization vision was always to working backward to the community needs, and as I mentioned, that we started in early 2014 by doing the what is the community need through the assessment from the expert partners. And during that interaction, we realized that menstrual hygiene is one of the biggest taboo in India, and it's one of the important area to work on. And after checking or after the need assessment, it reaffirmed our belief, and that's how we started working in this area.
What has been the impact of this initiative on women's health, empowerment, and economic independence in general?
First, to start with the awareness. So the first transformation we saw that in most of the community when we started in 2014, they were not very comfortable even to talk about it. Today we see that there is a transformation in the behavior where the women are talking about it, selling, owning the manufacturing unit, and they are the front foot to lead this initiative. So that's a one transformation we have seen. Unfortunately, in India, if we see that there are almost 72% of the population who still don't feel that spending on the sanitary napkin is important because of the economical prioritization, and mostly for women in their family budget, their kids education and other things are far more important than menstrual hygiene. So through this awareness and by making them understand through the public health department, through our community ambassador, now the women have started investing or started buying this. That's a third improvisation we have seen, because the product which they are manufacturing is biodegradable, it's not environmental hazardous. Second, it's a half a price of what is available in the market. Third is it's made by them in their village, so buying hesitancy of going to pharmacy is no more there because it's door to door selling, and it is also available with all the self help group who are selling in the community.
So, how do you work with organizations and communities to ensure the scalability and sustainability of this initiative?
So it was a journey in itself. When we started, we said that we have a good intent, but to get in this area, we need a subject matter experts. That's where we got the NGO partners like Yomini Foundation or She and We, who helped us to design, who also act like a knowledge partner for us to build this concept in partnership with the community. Over the period, we realized that we have a subject matter expertise, we have a good intent, but somebody need to own and keep this food live and self-sustainable. And that's where we felt that one of the important pillar is the community ownership. So that's where we got a panchayat and the SHG women come forward and say that, okay, you have asked for this need. Here is the subject matter expertise. Here is Amazon who is ready to invest, but are you ready to own it? Right? And that's where we got that commitment from the panchayat and from the women self-help group, and that's how it became a self-sustainable. To bring the scale, first 6 months it was more of getting right and getting also the adoption of this model in the community in the hyper local level, and then scaling across. So that's how we have put our strategy forward, and I think we are growing towards that path in a very smooth manner.
So, what kind of training went into training women, at this facility to ensure that they got a hang of things and learn the ropes?
When we started, most of these women are housewives. They don't have any earning, or they don't have even any bank account to have some saving. They didn't had a visualization of what the entrepreneurship means. So, will I able to do it? And what would be in it for me to do it was the first parameter which we have to break it. And that's where we said that you will able to do it. We have started with the tailoring, we have started with the handicraft, and this is like any other thing. It's like a one set of a thing, right? And few of them gradually has able to own their tailoring shop. They are able to own their own grocery shop. So we said that look, this has a one of your initiative. So that ownership was the one thing which we built. Second is, okay, now we are convinced to do it, but how do we do it? We are not educated, we have not had the exposure, we have never managed money, we have not know the safety and hygiene parameter and all. And that's where there was a rigorous training and exposure visit to the another manufacturing unit, telling them how the other women are doing their success stories, and that's how they got those strategy and the approach built. And last 6 months they've been able to smoothly approach, operate on that uh, kind of direction.
So, what model did you adopt here? Like, how did you identify who to approach? And you were talking about ambassadors, community ambassadors. Could you just elaborate on that?
So, as I mentioned to you earlier, we started with the NGO partner. After the few years, we said that it has to be owned by the villagers, and that's where the community ambassador model came into picture. Since we were already working with the women were already known the intention of Amazon and what we are doing in the community. And when we introduced this menstrual hygiene initiative, it was something they also wanted. So that's how we got a women mobilized for this intervention, because they have seen the result. They've been part of our initiative from 2014 to 2019. So it was another layer for them to be part of it. So that's how the mobilization happened. Second is getting, Mr. Arunachalam Padman, who has been, one of pioneer in this subject. We got him on board, who helped us to design the strategy and also the first basic manufacturing unit. He was the one who kind of procured and helped us to set up that. After that, there was a feedback from the women that okay, the basic machine is giving us the very basic sanitary napkin, but when we go in the market and we see Whisper or Stay Free, they're very thinner, they have a wings, so it doesn't move. It also gives us a kind of a longevity of usage, etc. So can you give us something which is far more better and convenience for the usage perspective? So that's where then we got Yomini onboarded. Then Yomini said that we have this machine which is end to end, but it also requires a training, etc. So we got Yomini on board, and then now we are in the second phase of the whole sanitary unit phase, where it is thinner, it is equivalent to what are available in the market. It also biodegradable. It has all the ingredients which can be dissolved easily. And second is it also economical in nature, and women have found convincing to sell and also able to get the market, because it's again depend on the demand and supply. It's not about what women want, but are they able to sell it? Is the consumer is ready to buy? And this is the model which was demanded more. So that's how that helped us to get into advanced machines.
And how do you ensure the quality and safety of the sanitary napkins?
For a quality, that's why we have got the subject matter expert like a Yomini and She&V. They are the subject matter experts. So there is an audit happen every week on the manufacturing, and the quality check is done. We being in e-commerce, and we know, and we've been working with a lot of, so our safety team has been regularly working with them to define the safety metrics of the operating this machine, how to make sure, what are the kind of protocol one need to follow, etc. And that's a training we've been giving her regularly. So there is an audit happen, which also important for a women to saying that one is earning money, but also following the processes and the operational excellence is important. So that has built over the period, and that is helping the women to follow those.
And what about the scalability? How do you wish to take it to the next level?
The idea is that we have a presence in 1,800 locations, right? We started with the 4 locations. So this is one of the unit where we are right now. There are 4 such locations where we have, and we are also having the reach to all 1,800 locations, where we are at a level 1 of awareness, and also making sure that women are coming forward to take the ownership on this kind of unit, because it's one is Amazon investing, second is also they owning it by themselves. So we're waiting for that phase, and this 4 unit is where we saw that there was adoption. So it's a gradually bringing that scale, where community and Amazon both coming together and co-owning this.
So tell us, in what levels did you of decision making you actually involve these women from the community? Like you're talking about naming the sanitary pad and everything. So
I think from the conceptual stage onward. So when we decided that we want to do this, the first thing we did that we took all the women to Mr. Padman's unit, where he is operating with the SHGs, and we showed them that this is how it operates. Are you interested? Then they said, okay, what is required? So they set up a group. So there is one is a finance group, one is a marketing group, one is a supply, like the raw material need to be purchased. So there is a one group who do the only the procurement, one group only managing the manufacturing unit. So they set up those 5, kind of a group among themselves. Second is, okay, now you have understood how others reply, and you understood what kind of work involved, right? Second is talking to the manufacturing, the the Yomini who has built this machine, there's an engineering team who's involved. So if there is any defect, how you need to work on it. So there is a one team who works on it. And there is an intense training given to 2 women. They are the only one who is responsible for that. Now the marketing team is the one who work on the branding, because there is also you need a license, the trade license for it. You need a, GST, because if you have to sell, you are no more not for profit, you are moving into the profit making, so you have to have the GST. And second is you also need to show your book of records and the accounting and things like that. So all of that, these women are trained, and they are the one who are taking the lead in every element. And if you see, the unit is also registered under their name called Prayatna.
So Prayatna is a name given by them. Okay, lovely. Thank you. Thank you so much.
Thank you.